Welcome to my Callroom classroom. I'm James Kirkus. I'm an anesthesiologist, and today I wanted to talk a little bit about psychology and the use of heuristics. So, first of all, a heuristic are mental shortcuts that people use to make quick judgments. And we rely heavily on these as humans in times of stress. So you can imagine if you were in a burning building and you were looking for someone to help you, you'd first look for a firefighter's uniform. Similarly, in the hospital, if you're looking for someone to help you, you'd look for someone in scrubs with an ID badge and dressed like they were there to help you. So this brings us to the concept of system one thinking. This is the way we think in an automatic, intuitive, and impression based system when we're in stress, and we're doing these micro assessments all the time. But what we need to do is figure out how we can use the patient's heuristics to match their system one thinking so that they have a positive impression of us before we even walk in the room. Once we get past the system one way of thinking, we can go into system two, which is slow thinking, analytical, logical, and conscious. That's where we need to be to have an effective patient interaction because they need to be processing the information that we're giving them. But they won't get there until we cross what I like to call the system one to system two threshold. So the better we can match their system one thinking to what they expect and how we present ourselves, the quicker we can get into the system two or conscious based level of thinking. So for me, I keep my uniform very simple, my presentation very simple, shoot right down the middle. If they're expecting their doctor or healthcare provider to look like someone, I want to be as close to that image as they can so that there's no delay in moving from the system one to system two. And that is where we can have our conscious interaction. And then I can show my personality. Then I can open up. Then I can, you know, tailor my spiel or whatever to what works best for them because they've already accepted me as a healthcare provider, someone who's going to help them in their need, and someone who's confident and capable. So I've already done 75% of the work based on the heuristics so that I can get to the point that I need to have a maximum patient interaction. So hope this helps. If this is good for you, let me know and I'll keep doing it.